13% of Alaskans are living with diabetes, and of that number, roughly 20% don't even know it. To keep up with health care, the cost can be crippling. Nationwide, our country spends an estimated $1.2 billion annually. Whitney Miller caught up with one Alaskan who's diagnosed with type 1, and she shows us what a day in the life of diabetes is like. Whitney.
Thanks, Megan. As you may know, there are two types of diabetes. 10% of those diagnosed with the disease have type 1, also known as insulin-dependent diabetes. Tonight, we introduce you to an amazing young woman who, with the support of her family and peers, has learned to cope with the disease. Like most teenagers, Amanda Amadimo spends part of her weekend morning helping out around the house. But there was a time not long ago when the smallest of tasks wasn't so easy to complete.
My grandma's house for 4th of July, and my cousins and I were running around her house, and I wasn't able to keep up with them.
Amanda was 7 when she started having health problems.
It was horrible. She had been what in hindsight I realized were classic symptoms. She had frequent urination, excessive thirst, and kind of the last straw was seeing her not being able to run and keep up. Sorry. Keep up with her cousin.
Amanda was rushed to the hospital and a doctor diagnosed her with type 1 diabetes. Her pancreas wasn't producing insulin.
The pancreas quits working. That's simplistically what happens, and it can be a genetic problem. It can be run into people's families.
Her little brother Joseph also has diabetes. The two went to Capitol Hill to meet with Alaska's senior senator Lisa Murkowski to advocate for diabetes research funding.
We do always have to make sure our congressmen understand how devastating type 1 diabetes is and how important it is to find a cure.
So devastating that the diagnosis over a decade ago meant a lifetime of change for Amanda.
You know that their life will never be the same.
She's had to adjust her daily routine to stay alive. Amanda's constantly checking her glucose levels and making sure to count her carb intake. She wears an insulin pump daily, which monitors her levels and administers the appropriate amount of insulin.
I only have to change it every 3 days, so that's just 1 needle every 3 days versus 10 needles a day.
Amanda's heading off to college next year, and like most moms, Sherry Roberts is worried about her daughter.
I don't know what will happen when she's in college and I'm not there to come help.
The tools and technology to deal with diabetes have come a long way, and Amanda says she is confident she can handle it all on her own without her mom there to prompt her testing.
But I think it's going to be kind of hard at first, being on my own, because I haven't been on my own before, but I think it'll be okay.
She plans to head out of state to study athletic training.
I've never let diabetes stop me from playing sports or doing anything active.
Staying active is Amanda's top priority as she carries on through her daily life as a type 1 diabetic. Remember, if you are diabetic, balancing your insulin and diet is the key to staying healthy. And of course, like Amanda, regular exercise can also be beneficial.
All right, Whitney, how important is it to let others around you know about your disease and your diagnosis?
Well, Megan, that is a very important point. In Amanda's case, going off to college, both her and her mother feel it's the best thing she can do to keep safe. If others know what's going on with her, they can help in a time of crisis. And tune in next Wednesday as we explore type 2 diabetes. It affects nearly 90% of those who carry the disease.
Thank you, Whitney. Great story. That's Whitney Miller reporting for us tonight.